are about to listen to the Yin Yang Podcast.
It's kind of like we have everything on two different sides. It's like kind of a new thing. I guess you just have to try it yourself. Just listen.
You are about to listen to the Yin Yang Podcast.
Alright, welcome back everyone. He's Yin.
And he's Yang. And this is the Yin and Yang Podcast.
Alright, we just want to thank everyone who listened to the podcast last week and for tuning in this week. If you're new here, please consider subscribing, give us a like, and don't forget to hit that notification bell. And also select all notifications so you don't miss an episode. It really helps out our channel, and it helps us reach out to more people, so we can't thank you enough.
Yep, and a special shout out to Nathan Jones for commenting on our last episode. We really appreciate it and look forward to continued support. We have a guest tonight, and her name is Shannon Barger.
Alright, and then don't forget, at the end of this, we got a little something special at the end of the episode to announce. Isn't that right, Yin?
Oh, yeah.
So make sure you guys stay tuned to the end so you can hear what we got to announce. Topic of today's episode is which is better for the United States, a privatized healthcare system or a socialized or single payer, however you want to define it. And we got a question of the day for the comments, something we're going to start new. So question of the day for the comments: if the United States had a socialized or single payer healthcare system, do you think the U.S. would have been more prepared or would have handled this COVID-19 situation better? Please comment down below what you think, and we want to hear from all you guys. That's how this channel works. We want to encourage people to talk. And Yen, man, how you been?
Pretty amazing. FMLA and me getting to stay at home. So pretty awesome.
Yeah, with those newborns, I can imagine that, man. I wish I could come see them, and obviously, quarantine, social distancing. That's kind of safe to not, involve 1 week children.
Yeah, they're cute. They're cute as heck and as big as a ham bone. How about yourself?
I'm hanging in there. I'm doing pretty good, as long as we're not trying to get banned already.
That dude was so hostile.
Yeah, little context of listeners. When we stream on Twitch, there's a couple self-promoting Twitch streamer accounts that you can, publicly advertise yourself to try to get more viewers into your channel while you're streaming. I accidentally clicked on a channel that I actually follow that I like to listen to, and I promoted myself, and they banned me right away, and they reported me straight to Twitch. And I'm like, oh, well, and they direct messaged me saying, hey, you're banned from this channel, and you've been reported to Twitch. And I'm like, oh, well, my bad. I just want to let you know it was an accident. We usually don't do this. And this guy was a dick. He's like, yeah, of course it won't happen because you're banned. I'm like, well, no shit, Sherlock. Thanks. And this all happened like this. This is why the episode started later. The people listening on Twitch, obviously, because yeah, we usually try to keep it about 8:30. But I had to deal with that and talk to this guy because we're so small. Like if Twitch decides to contact me, which I'll be like, oh, thank you, Twitch. Oh, you're contacting me? Thank you.
Like wow. We're like, yeah, don't email that guy again.
Yeah. But like
we get 10 of them a day from this guy. He has no life, so.
Yeah, and this guy's got a great screen name, Finger Me Danish. I mean, that's classy.
I guess he's like has heavy hands. He likes to eat Danishes, so just like.
I don't know. Nothing like getting cussed out by a guy named Finger Me Danish.
I wonder if he's like Danish too.
I doubt it. I doubt that. All right.
Screen names. So we need to do an episode on screen names.
Well, we just like troll people's like. That'd be kind of funny.
They have so many of them. They're just every time you see one, you're like, and you sit there and you like read it. It's like a license plate. Like it's just so funny. Like once you figure it out, if you figure it out, like you want to just ask them, like somebody with a cool freaking license plate that you don't kind of understand, but you kind of get. But
right.
What's up with that? He's like, it's my dog. You're like, oh, okay, yeah, that makes so much sense. I was going the other direction with that.
Well, I'm glad you're doing good too. So let's go ahead and bring in Shannon. Shannon, you there? Hello, Shannon. How are you today?
I'm pretty neat.
Our first guest. No pressure. I mean, no pressure.
No, never. My life is anxiety, so this is okay.
Perfect. Nothing like speaking to absolute strangers half the time to really
Yeah.
rouse up that anxiety.
Well, we're from the Midwest. Speaking to strangers is our life. So,
Yeah.
I agree.
So, Shannon, won't you tell the audience, a
oh,
little bit about
okay. Yeah.
yourself?
All right. Well, I know, super duper exciting. Currently a stay-at-home mom. I have two kids. I have a son on the autism spectrum, and we're a military family, so we move a shit ton. So me being at home and being able to like take care of all the stuff that he needs has been really important. Yeah, so that's what we do. I'm super mom, kind of, not really. I'm mom trying her hardest to pretend she's super mom. So
I mean, all moms are super. Let's just
Yeah,
put
I
that
was about to say,
there.
every mom's a super mom.
yeah,
That's
so
for
but yeah,
sure.
that's just me.
All right. Well, that's awesome. I'm really glad you were able to come on. I mean, we're both really glad, honestly, but that way.
Yeah,
It's not like Yin was just like, oh, we got to have another person on here. God, no, okay, got it.
She's not taking over my spot, is this what it is? Is this just like an interview for somebody better? Oh, I'm sweating bullets over here.
All right. Let us know. All right. New second question of the day. Comment down below. Who do you want? As the second. The other chair. Do you want Yen and Shannon? Let's put that out there.
That's awesome. I love it.
Yen, you're fired. No, I'm just kidding.
You can't fire me because I quit.
I don't know if it will help my resume or my interview process at all, but I can in fact actually cook. So that means absolutely nothing to anybody out there, but for you guys.
Yeah. Oh yes. We all love food.
All right, so let's get on topic here. So healthcare.
Ready.
It's a big topic today nowadays, especially not only with an election year going on, but with this, obviously this pandemic going on, COVID-19. Everyone is talking healthcare. Should we change it? Should we keep it the same? It's a continuing argument, and I think, and with today's climate, it's always, if you don't believe this one side, then I hate you if you believe this, or just people are going at each other's throats. And we want to encourage this conversation to be something everyone can talk about without having to feel like they got to kill each other over it. So obviously, like, all three of us have talked off camera, and we all think a little bit differently. We have different views, and we just want to share those views. So, Shannon, if you kind of want to start off, like, how do you feel about the current healthcare system?
Well, okay, so there's like particular reasons why I feel the way I do. I mean, granted, everybody has reasons, but I have such very different experiences with healthcare. Like, for starters, I started off on my parents' private healthcare plan, and then the ACA came through, the American Affordable Care Act, and so I was able to stay on my parents' plan up to age 26. Um, and then when I had my first child, I was off my parents' plan and I was on state insurance, Medicare, Medicaid. And then after my husband joined the military, we are on private military TRICARE insurance now. So I've gotten to see different perspectives in how our system works for different people, different times, different prices, different, how the whole system kind of works, or I should say doesn't really work together, having so many disparate parts.
Right. I mean,
So,
that makes sense. You kind of respective on all of it. Like, you've been through it all.
like, yeah, so this is like, oh, this has lots of co-pays, but you get great service, or this, you don't pay hardly anything, but everything is denied, or this is the list of what you can have and you can't have. So I feel like I've got kind of a pretty rounded perspective on a lot of it, and it helps that my husband is in that's his field of expertise. He is in medical care for the United States military, so I get a little bit of the administrative side as well. So
That must be nice. Like, oh, I can just look over his shoulder and like, oh, we getting covered. He's doing that paperwork right.
Well, no, surprisingly, they are so old school. We get a giant ass booklet like twice a year that tells you, here's what we're going to cover and here's what we're not going to cover. And it's funny. It's not any even techie. I mean, it's the Army. Like, the saying something has military precision means absolutely nothing if you've actually worked with the military.
I can completely understand that. My favorite oxymoron is military intelligence. So,
Yeah, exactly, 100%.
but not
So-
that we don't respect.
No,
we
no,
respect the
respect is,
military. Yeah, we respect the military. Trust me. I mean, we full
But we are
respect. But
American. We
Yeah.
are Americans, so God darn it, we reserve the right to make fun of it. So
yes, exactly,
Yeah.
exactly. And I will gladly use that right, especially being, prior military. That's it's easy to do.
So I've seen how utterly dysfunctional a system that has so many moving parts like that don't work, aren't sized appropriately for different needs is. So I suppose my perspective is a kind of a Medicare for all kind of a perspective, or single payer healthcare, as you might call it. Um, I like to call it no pay at point of service healthcare, because that's the big thing. People do not want to upfront put up money when they get their healthcare. So that's what I call it. No pay at point of service healthcare.
So kind of like almost like a Bernie Sanders approach.
Yeah, I'm not gonna lie. I am a huge Bernie Sanders fan. I know that probably gets a lot of people like, oh, you commie, whatever. But I mean, let's be honest. We've all heard the jokes
Right.
and the nicknames and the horrible things about it. But when you break down the concepts, they're really not that far fetched. And it's been the same stuff he's been talking about since like the 80s. So.
Okay. Yin, you want to go ahead and put out your 2 cents on what you think about either the current healthcare climate and what your perspective on healthcare is?
Yeah, I think there's there I was just listening, I zoned out. But
You're fired. Okay, Shannon, you sound great.
I know, right? I think that it's the system is not bad. And it's like, I don't think it should change that much, but I think it should definitely, like, if you work and you have private insurance, you should be able to have both. And I think we need to cover a lot of, we could dump more money into it, but I think there's there's a lot of cogs in the machinery. But there's a lot of moving parts, but there's cogs in certain parts. I think there's like a lot of money that is being wasted, and a lot of money that can be diverted into different places. And the Medicare system it's awesome, but I think there's a lot of people taking advantage of it on every level, from the very top to the very bottom, being the actual patient, So, not saying that everyone does it, but I'm sure that, and that's just my opinion, because
Right.
I've even heard nurses, they're like, oh yeah, that's, actual nurses, people in the nursing field just know that there are not scams, but people take, companies taking advantage of the fact that, these hospitals are getting checks from the government for taking care of a certain amount of patients, and just, running them through the gamut. Oh, you need a $5,000 X-ray for a freaking spray. And granted, in the medical American Medical Association, they have procedures that they have. If you do have a spray, you have to to a certain degree, and these doctors are putting their work on the line. So there's and these businessmen, I think, sometimes take advantage of the medical profession, because they don't get a lot of government supervision, because the government's like, well, these are medical science professionals, who are we to tell them what to do? And that's why they have the American Medical Association and all kinds of stuff. But that's my view on it.
Okay.
It's good, but it could be better.
Yeah. So basically, just kind of what I took from that to summarize, you're actually more like, this is kind of funny, more on the. It sounds like yours resembles more closely to, I'm trying to think of the candidate that wanted. It's more of a Medicare for all who want it type thing. Like, you give Medicare for
That's
everybody.
Pete Buttigieg.
Yeah, Buttigieg. Yeah.
Pete
So-
Buttigieg
so
wanted
what-
that. Yeah.
So basically, instead of like the Bernie Sanders approach, where it's Medicare for all and no private insurance, you're okay with Medicare for all for everybody, automatically enrolled. But if you want to supplement it with private insurance, you can do that.
Yeah.
Okay. So wow, we're getting.
But there's also not a lot of transparency, and just all the cogs from the money aspect and the big business aspect. You know what I mean? Just that transparency needs to be, needs to be there. I don't think it's there. There's, but yeah.
Yeah.
And you got to listen to the doctor. That's the thing. As an adult, but as these, children, as I'm seeing, it's definitely a different kind of setup there. But go ahead, I want to hear your
Oh,
perspective on it.
you're good. I like that you finished your point. All right, so I mean, I'm gonna sound like the crazy person compared to you two because because you guys know my views is a little differently. But anyways,
Yeah.
so I'm okay with privatized healthcare. Um, I like that there's a small safety net for Medicare for lower income housing, but I don't see that as a solution for everybody. I don't see the point. Like I don't like the fact that the government take full control of the healthcare system just because I'm a believer of smaller government. So more government taking control of our healthcare, I figure out to be more red tape, more hoops to jump through, and overall, um, worse care overall. That's just my feeling on that. Honestly, I think we can improve. Like, I don't think we should radically change it and just strip people of their choice of healthcare, what they want, because some people do get good healthcare and they do work really hard for it. Especially unions, they negotiated their healthcare, and if we took a Medicare for all approach, all those union workers that fought for their healthcare would lose that. So honestly, I think a private healthcare system, though imperfect, is better than a single payer or um, socialized style of healthcare system. You can have more innovation because there's a little bit of competition there. Not all, but honestly, to even improve on that, I think a free market system would do even better. That's just my take on it. Honestly, if we could just get government out of it completely, like in a free market where you can negotiate with your insurance company, and there'd be even possibly even more insurance companies that could pop up for due to competition, or you'd be able to negotiate with them like, hey, I can, like, you have to pay for what you need. Where I know, like, example, TRICARE, it's the blanket, like, just over $200, and they cover this,
Yeah.
and this is what you get. Well,
Yeah.
in a free market, you could, like, okay, well, that's awesome offer, but these guys are offering me this. I'm going to switch over to them if you don't give me what I want. And I think it's just more freedom, less government involved. But there's obviously cons to that, where it's obviously less regulated by the government, but it's more regulated by the people. So if that business goes under, it's probably because the market, the people, didn't want that insurance, and it was probably shitty insurance. So that's my feeling on it. I think a free market style would be overall the best, but between what we're talking about now, privatized or single payer, I think you know the I think the privatized is a little bit better just because it encourages innovation, um, and it's less government control. And I think the government, just slows things down, and overall it just jacks up the prices for it. So that's my opinion on that. If you guys want to comment on that, because I know you guys think differently, way differently than that, feel free to
I'm trying to think about. I'm trying to think about which point I want to think about the most.
go for it. I mean, should
You've got. Well, I was just thinking about the point where you said that you were afraid that there's too much government in healthcare. Um, and I know a lot of people are really, really afraid because it's like if you don't trust your government, like because as often as our government changes, more or less every 4 years, and it feels as though, especially the last few decades, it's been even more partisan and tumultuous, and it's like you really can't trust I mean, sure, there's a certain level of mistrust of the government. That's the history of the United States, mistrusting major bodies of power. But it's even gotten worse over the years as we've become more partisan in our politics, and the American citizens become more of a chess piece rather than people that should be cared for within our nation. And I can understand, being afraid of giving the government more control, but I think the problem with that is people don't realize just how much control they already have. And the fact that the reason our healthcare system functions the way it does is because of how much the government does, in fact, control. Like 2/3 of everything that goes on for our government systems, which includes Medicaid, TRICARE, the VA, all kinds of those government programs, like 2/3 of that's all controlled by the government. And TRICARE, I know for a fact, works the way it does because although it is run by the military, it does in fact have that civilian oversight. That is one of the major touchstones for any sort of military program.
Yeah, United
Like,
Cochronia. Yeah, they run
yeah,
they run the
exactly.
healthcare.
It's
Yeah.
got a civilian aspect that keeps it beholden to working well, but at the same time, it works through military governmental systems, if you will, that know the way that they want to set things up and run things. So I just think that people's insurance is a lot more controlled than they realize. And so fearing that the government can't control that seems like a non-issue to me personally.
Well, like that's another thing. Like you said, like the government already has so much control, and I agree. But I think they have just in general, as a general world view, I think the government has too much control as is. That's why we should step away. I think we should step away from relying too much on government control, and step into like the free market approach. I think it'd be an interesting experiment. Like let's see how these companies really test up when the consumer actually has full control of what they're paying for, instead of like what the government could control and everything. It's just my perspective.
I like that idea. No, I do. I like that idea. I like the idea of it being basically more or less classic, like Roman symposium kind of a classic, where it really was you have one person that legitimately represents all people's voices. The trouble is we really do not have that citizen to government direct line anymore. We have so many middlemen in between,
I agree.
And we can't really guarantee that. So we can't even really say that the government controls everything and the citizens should control everything, because the point is there's still lobbying groups in the middle of that. So even if we did give the government less control, it doesn't matter, because it's like the citizens are not going to have control. The lobbying groups, the people that have the money, are going to have the control with a free market like that.
I think America still works the same way. We vote in our representatives. It's just we don't vote on the ground level anymore. We just vote. By the time we get to where everybody votes, it's all the middlemen. You're right, but we do still have the power. We can go research our representatives, see what our representative says, how he feels. I know how my representative feels is not how I feel, but at this point, like I live in a county where it's a red county, and it's. That's the way it is. I mean, my vote really is not going to change the representative, and that representative's still going to vote for, and then against what I believe. But I mean, the awesome fact is that I have the, ability to vote.
That's true.
So, but yeah, on the ground level, it's like, I think this, the government has turned it into like a, Ohio State, Michigan game. It's like either you're red or you're blue. Yeah. And it's like,
exactly.
And it's literally like I relate it to actually exactly like football. I'm like, because I'm not a football person, but I see how they act, opposed to the way it is lately. Because it's been like this for the last 10 years, where it's literally just kind of like after Obama, really, like it's just really hardcore left. The pendulum swings.
I would say even before then, quite frankly. I would
Clinton.
say this is a long time coming since even Clinton, because that's when the vitriol and the divide really even has been building for at least the last 30 years. I mean, it's been a lot less subtle within the last decade, but I'd say it's been building for a long time. I mean, you don't get the kind of decaying systems that we have suddenly overnight. It's institutionalized. It's within the entire system.
Yeah, I agree. I think Obama really brought it out, though. I think he really got it out of the,
You got to ask yourself, you got to ask yourself how much of this was festering and we didn't talk about it.
It's
like,
I mean,
it was kind of like, it's kind of like this whole COVID-19 pandemic. It's like we are forced to have these conversations at some of the most,
dire,
times.
Worse,
Yeah, it takes literally our country almost completely falling apart for us to even begin to construct any sort of conversation that's not just, well, mine's going to cost less, but so and so's voting for it, so I'm not going to vote for it. Or this company, they want to put this writer into the bill, and even though I agree with absolutely everything else, there's this little nugget of like slush fund that I don't agree with, so I'm not going to vote for any of it, or like that kind of stuff. We can't have that kind of nonsense anymore. We can't afford it.
Yeah, I agree.
Yeah. Just a little joking kind of point, like, hey, smaller government, like they wouldn't have to worry about that. But I'm just
very funny.
Just gotta throw in my little 2 cents right there, a little nugget of. But
I don't.
Yeah, go on.
Yeah, go ahead.
Okay, I was just gonna kind of transition since you brought up COVID-19, like its effect on healthcare and how it's brought this conversation up. Like let's kind of just answer that question. Do you think, this country would have been more prepared, or would have handled the situation better? Say, like 10 years ago, we would have jumped into a socialized or single payer healthcare.
Okay, here's what I think. I think we might not have handled it more appropriately, considering, like, okay, my personal views on this particular administration we are currently living under does not feel as though our response would have been good. However, if we did not have healthcare tied to employment, I think it would make it hurt a lot less for a lot more people. Like, I think there's a number, something like 30 million people by next week are going to have no health insurance because they are going to be unemployed. Like, that is a crazy number of people to not have health insurance in the middle of a pandemic.
Yeah, it's pretty crazy, but like just to kind of bounce off of that, um, you don't have to buy your employer's insurance. I know like most people do it because it's cheaper,
Mhm.
but you have that choice to say no, this sucks. You can just call any insurance company and get them. Like right now that yeah they're unemployed, but they could call any other insurance company and like try to negotiate with them right now. Like with a Medicare for all, like say our government shuts down, no one has health care.
I know, but they have, when you think about that though, let's say, they have a captive audience though, which means they can charge whatever they want. That's my major problem with that.
Yeah.
They really do. It's like, hi, we're in a pandemic and I just lost my job. I have no health insurance and I am at XYZ major risk. Like, that was one of the major points of the Affordable Care Act that was passed a few years ago. Pre-existing conditions. Like, they could refuse you for any reason. And like right now, if we didn't have some of those provisions in place from, the attempt to cobble together some sort of working national plan, then people would just, there'd be so many fewer people covered left and right. I mean, like, it wasn't perfect, but at the same time, like, we're hurting a little bit less this horrible, time by having some of those rules in place. But they still have a captive audience of, I have no health insurance in the middle of a crisis.
Yeah,
Right.
I think the insurance companies are, yeah, like some similar to what she says. They're basically, have the power. It's like once you dwindle down to a couple bit, huge businesses like AT&T or Spectrum, like, well, they both suck, but like,
But
and they
yeah,
charge ridiculous amounts, but like, I don't have a choice, and that's what happens.
yeah.
All the local, I mean, not all of them, because Matt already discussed this. There's like one like local internet service provider, but like
Yep.
literally like what? Come on, dude! Like the
It's like,
infrastructure
hi,
of these companies.
do you want Comcast or do you want HughesNet of insurance? Like,
Yeah,
like, good luck, buddy.
yeah, exactly. And it's just like, yeah, if the government doesn't step in and be like, hey, we got to offer these people something because
Mm-hmm.
this person that works 3 days a week, busting
Doesn't
tables,
qualify.
and the other 3 days, and they're putting stuff together. There's a lot of those people out there, and there's
Yeah, that's where, well, that's kind of a little personal. That's where my family's at right now. My dad left his previous job of 20 years because they did a restructuring of management, and it was ugly. So right now they are paying like $2,000 a month for in between Cobra coverage. Like, his insurance with his company was not that great, but not being with his company is so darn expensive. But good luck finding, like, he wouldn't qualify for Medicaid or Medicare, and he doesn't qualify. He's with his company, so it's like you got the people that are kind of fell in the cracks to consider too.
and
Right.
there's a lot of them that fall in the cracks because that's our infrastructure. That's everything. Everybody, like you said, everybody plays a part in our economy, and
Hmm.
Yeah.
Yeah.
they do too. And they need health coverage just as much as like everybody that has offered private. Because if you're working for a company and if you're lucky enough to get decent private health insurance, you're
Mhm.
lucky.
Yeah.
You're pretty much
And
lucky.
sometimes
They're
it's
like, wow.
really awful.
Yeah,
I
yeah.
mean,
Even the good insurance is awful. That's the
it
thing.
is.
But we don't have a choice in the matter
No.
because that's the way it is.
Well,
Like
that's-
I can't get any type of government health insurance.
Well, that's what it's funny you bring up choice because that's one of the bigger things why I'm against like a Medicare for all or a single payer program is because you lose that
Mhm.
choice. That's why I more agree with the free market system because there is like it would
Yeah.
it would
The
increase
mom and pop insurance
like
companies.
you never know like those people could still be in business where these bigger chains are falling apart. Like you said, people fall through the cracks, but those little companies could pick them up. We have like think about just our actual business infrastructure. We have
Yeah.
think fast food. We have McDonald's, Taco Bell, Arby's, all these big chains, and then you go to your local. You have tons of little restaurants locally around you. Like
As well as if you need to have like Go ahead.
I was imagine if insurance was like that. You had like the big, like Cigna, United Croconia, like these big insurance companies, and you had like the little mom and pop that were still, like they were still good. But they were. It's more like a
I don't
local
think
community.
that exists though, dude.
It doesn't. That's what I'm saying. It doesn't because our current system. Our current system doesn't allow it because there's so much red tape and the government controls all all the healthcare spending, and you have to jump through so much red tape, and the regulations are imposed by the government on physicians and Medicare, like on medical products. There's just
they do that with everything though.
Like, exactly. That's what I'm saying. We need.
But that's for the protection of you don't want freaking Joe Bob down the street brewing moonshine with radiator fluid. You know what I mean?
Well, moonshine's illegal anyways. It's a bad
think the problem with that, though, is while people would have the equality of opportunity, people would not have the equality of outcome. Because somebody who pays XYZ dollars for their insurance would be probably more likely to be denied care compared to somebody who pays a little more. And I find that absolutely morally bankrupt. In order to get care in the United States, it doesn't matter what you need, that you have to pay more. Because, I don't agree with that at all. I think everyone should have a level playing field. Everybody's got Medicaid, which means everybody has, they know exactly what care they're going to get. Period.
All right, that's a point you brought. Like I don't agree with that premise. Like equality of outcome or equality of opportunity equates to equality of outcome. I just don't agree with that because I believe everyone has, and like I'm okay with equal opportunity. Just I don't like people. I believe in individualism. So just the fact, like, say, like, person A and person B, walk the same path. There's obviously, like, they're two different people. They shouldn't end at the same spots as each other. There's obviously going to be different branches they could take and everything. That's why I don't think equality of opportunity should equate to equality of outcome. So that also that destroys the kind of the American way of like, hey, it's this opportunity. You want to grow your wealth and, kind of like not rise up, but you want to earn more money to give a better life for yourself. I don't think we should come through with a bulldozer and just flatten everybody out so people aren't wanting to better themselves and trying to like kind of like with pride. Like me and Yin were kind of talking about this yesterday where if you level the play for people will be like, well, I could just kind of sit around on my butt and get paid the same no matter what I do, kind of thing. So
I think there'd still be an opportunity for people to, have that capitalistic approach. Just because they take a little, instead of like 5%, they take around 15. You'll still make things work. If you're broke, you're going to be broke. If you're making money, you're going to be making money. It's just we got to have that. Go ahead.
See, but I understand what you're saying about that, and it's like that's really hard for me to rectify in some ways because it's like. I don't know. I have so many family members that are just so darn poor. And
I know. I understand that. Yeah.
Really crappy insurance or no insurance at all. And the first amount of equality that they ever experienced in their lives, and the first amount of actually being cared for the way they deserve to be cared for, was being able to have state insurance and being able to have the most basic minimum done for them. And I think absolutely everybody deserves that in this country. You live in this country. You're a citizen of this country. You deserve that, period.
Yeah.
Right.
Easy. Yeah.
I mean, could you imagine imagine with a free market where not only were the insurance companies fighting with each other, but also the hospitals were competing in cost, where they could say like a young person in their 20s, like, they're never going to say just hypothetically, like, oh, I'm never going to get hurt. Why should I have insurance? And say they break their leg, and instead of going through the insurance company and all those red hoops, like they have no insurance, they go in there like, all right, well, this hospital, $200 stay. Type thing, like could you imagine a system like that though? Like I know it's far fetched. It's about as far fetched as everybody.
Technically, you can do that. I mean, this sounds really nuts, but technically, you can do that. That's the thing, though. What we really need to do is simplify and have it between yourself and your government, because the people in the middle, they have no obligation to tell you what costs what. You can ask. Legally, they have to tell you. If you have a hospital bill and you're like, I would like to see an itemized bill, you can go to your hospital or your care center or wherever you've received treatment. You can look at your bill and you can ask someone about every single item on your bill, and you can ask, why does that cost that much? The thing is, we are not told to do that. We don't know how to do that, and that is just another, fluff cost from a middle person administrative middleman, increasing our healthcare costs that way.
All right, well,
Yeah.
let's just get rid of
Same
the
with
middleman then.
pharmaceuticals. Yeah. The
Yeah,
middleman is the one that makes all the money, the
the middleman
instruments.
is the insurance company
I
at
mean,
this point.
I see the middleman as government, just like, you know what I mean, just
Okay, okay.
you know
No,
what I
I
mean.
understand.
That,
Yeah,
so
yeah.
we
No, I
both
see.
agree. We both agree. Cut
I
out the
see.
middleman. We just
Yeah,
disagree who
but
the middleman is.
different. We have a different. It's like when you go to the museum and you look at this thing one way and you look at the other way. Oh, it's dog. No, it's a duck.
Yeah.
Or
We
Yeah.
whatever.
so
So
it's so this is my like kind of like I'm just gonna backtrack a little bit. This is kind of like my feeling on how like most Americans are. We all want the same thing. We all want the best for everybody. It's just we have like people have different approaches about it, and you can't
Yeah, you
figure that
definitely.
out unless you talk to people. Like I'm just want to get on my pedestal for a second.
Fix your
yeah,
hair first.
yeah. So I don't know. And then the other thing we were talking about, equality of outcome, equality of, and having everybody at the same level of government care. It reminded me of, I know this is like super nerdy, and I've had this like rattling in the back of my head since we, said, hey, we're going to talk about healthcare for this. There is a thing known as the boots theory, and I don't know if you guys are familiar with Terry Pratchett,
No.
the author.
No.
He's a fantasy author. He's a really well beloved fantasy author. Anyway, so there's a character of his, and his name is Captain Vimes. And Captain Vimes has something known as the Boots theory of socioeconomics. And this is my problem with private insurance and then letting other people buy for smaller insurance. The Boots theory of economics says this: a poor man is able to afford, let's say, a $10 pair of boots. They're not very good quality, but that's what he can afford. And so he constantly keeps having to buy these boots because basically the sole is cardboard, and it gets wet and the boots are completely worn out within, like 3 months. He has to buy new boots. And over time, he spends so much money on these really shitty boots, and he's in constant pain and his feet are in terrible condition because he has to pay for the $10 boots. The rich man, however, who immediately has $50 to spend on these beautiful, gorgeous leather boots, will spend that $50 on those wonderful boots one time in his life, and he'll have a pair of boots that will last him the rest of his life, and he'll have spent less money overall than the poor man who constantly has to pay into a system. And that is my problem with having some people pay for basically the Rolls Royce of insurance for whatever they want. If you pay for it, you get it. Versus the person who is paying, the $2 afternoon movie version of insurance. It's like, how can we guarantee that they both have the same quality? I mean, a person who has brain cancer and lives in the upper 1% bracket should not have, have a more opportunity to survive just because his treatment, was different from the person who could afford less treatment. That's just, like I said, that seems morally bankrupt to me.
Right. That's but the only problem with that, that's very anecdotal. Like it's kind of like a situational thing. I get where you're
I
coming from.
know.
It's like but what
But
about
I've
what about
seen-
the poor
I've-
man?
I've seen-
Like I mean, what
I've
if
seen that kind of thing in practice though, because like I said, I was on private insurance under my dad's insurance. When I was pregnant with my son, I got very, very sick. I was in the hospital for 3 days. I had a horrible infection and kidney stones and horrible things. And they were all ready to pay for everything. And then they discovered that I was pregnant. And they decided arbitrarily that, oh, well, you're dependent and you're pregnant. We're going to say that this sickness of yours, which by the way was not pregnancy related at all, it was a bacterial infection and kidney stones. They decided arbitrarily that this was going to be related to pregnancy. That's how we're going to code it. And instantly they said, "Hi, you have no insurance now. Pay us $10,000."
Yeah, that sounds something like
that's
what an
that's
insurance
messed up.
company would do.
That's messed
Yeah.
up. But
Yeah.
I still don't think the same could apply if like the government controls your insurance. Like if you look at examples that I've seen in Italy with this COVID-19 situation, like they're holding back respirators from the elderly because they're like, well, you have a higher risk of dying. Sorry, you're on your own. So like that's another like downside of having the government control everything because then they regulate it instead of the insurance company.
Well,
and
that's
you,
Italy also.
but I'm
I
just
th- I
saying
think
it's an
that's-
example of a socialized or a single payer healthcare system.
Well, at
Like-
the same time, the United States doesn't have a system like that, and yet we were unprepared as well. We don't have enough
Right.
ventilators.
Right.
either. Like,
Well, I know. I'm not saying about ventilators. I'm just saying
just like,
the
no,
point.
I understand that.
The
That's
point wasn't
fear
the
of, like,
ventilators. It was the point of the
Yeah.
government having say of in the healthcare system saying
I know.
no because you're this age. Which there's faults in both systems. That's why I was saying.
No, I understand that.
No.
When you say government controls everything, for a lot of people that brings back the images of the Soviet bloc and one big government controlling the communist. Oh, it's Tuesday, so on Tuesday we have red car, and on Wednesday we have blue car, and there are two kinds of car, and like, and it's just that one.
That's a little, oh my god, that was a great accent. I'm sorry.
It's like, on Thursday, orange car, we look crazy, and I understand that though. There's that fear of government, meaning bare, sparse, basic, and underfunded. But the thing is, if we didn't have to fund and we didn't have to deal with arguing with insurance companies, then that literally releases billions of dollars in funding. That's not hyperbole. Billions of dollars in funding for the government to go, you know what? No, we need to not argue with you whether or not insulin should cost $1,200. We can use that and we can buy ventilators.
Yeah.
Yeah.
But most of the reason we have to fight with insurance companies is because they're so heavily regulated by the government. They have to like there's not much they can do. So there's constant arguing and fighting.
I'm gonna have to say no. I'm thinking that like if you give a business complete control and like you know what I mean, like and it's all set up around making money and you just look at the bills from your next freaking doctor's appointment and then they'll answer all your questions. But the nurses need to get paid, the people making the medical equipment, but where's the transparency? And let's do the arithmetic, because that's the answer. Like, I mean, I hate to say it, like Bill Clinton said, it's simple arithmetic, but you have to get the actual, the XYZ, you know what I mean?
Yeah,
What's
like I said, fair point to people. Seriously though, if you're listening, you are legally allowed to ask for an itemized bill. That is my big take. If you learn nothing else from this, you are legally allowed to ask your care provider to give you an itemized bill. They cannot say no, and you're allowed to question that.
But when you get that itemized bill, all of those prices are already set, so you're just getting like, you know what I mean? You're looking at your bill for groceries. Oh, no, you're like, wow, the asparagus costs $20.
No, you'd be surprised. Like, I'm dead serious. You'd be surprised if you talk to somebody about how much something costs. You'd be like, why does this cost this much? You'd be surprised how much they can finagle with. When I got sick and I instantly had no health insurance, I was unemployed. I was like, I'm sorry, I have to call you and let you know I cannot afford $10,000. I'm a student, I cannot afford it. And they said okay, and I didn't have to pay. Literally just like that, $10,000 gone.
They have that power.
They have that power. I'm serious. I make a major point. Fight your people. Fight those people.
Yeah, I mean, they're not the ones making all the money. There's somebody else down the line, and they already make money off of everything else.
Yeah.
Let's see, Medicare payments totaled $731 billion.
Yeah.
2008, or no, in 2018.
It's only getting worse too. Like because of the administrative cost, it's insane.
Yeah, we need to take get it fixed and then work on it. Because I don't think like the free market is a good idea to do. Even after this COVID-19, like I could imagine the free for all. Like it's already a free for all, and it's just like you're just opening the floodgates for malpractice and just like the government. Like what? We can barely regulate what's going on now.
I mean, if you think the government can only regulate what's going on now, could you imagine if they have to undertake the entire healthcare system? Yeah, could you? I mean,
that's a hard one because I know the way. Way military insurance, and you know about this. Military insurance is already 100% government controlled. I know from the military side as a military dependent, and how that's covered. And I know already, like for instance, for our insurance, I do not go onto base unless it is absolutely mandatory because it is a nightmare dealing with the administrative side of that. So we prefer to go off base, and I pay a copay or I pay a small fee to see in-network providers.
Yeah, because a private care provider, even though it's funded by a government entity, like even you're making the point right here. Like you go to the military base, the government controlled healthcare area. It's okay. Like this, it's not bad.
It's a pain in the butt.
It's a pain in the ass.
More than anything.
But you go to the private one, you may have to pay a little copay depending on your insurance, obviously. But it's usually a little bit easier. It's more simplified. I mean, that's kind of my point.
That should be, but that's so criminal. You know what I mean? Like, I am literally more than willing to pay extra just so that I don't have to deal with the system that is not big enough to deal with the number of people. If we had a bigger system, it could deal with more people. That's my point for that. Our system does not do enough.
I disagree because I think if the government gets any bigger, we're edging to the point of totality or like authoritarianism. Like we're not like they're not going to be able to control it with like saying, oh, you know, with free. Like I'm trying to figure out how I want to word this. I'm like losing my own point here, but I'm losing my own point here because I have so many things going on in my head all at once. But
yeah,
if like the government gets bigger, that just you know who's all gonna control that? Like you think like more government control over like even a bigger system. Like it says it sucks now. Could you like I said? Could you imagine if they controlled even a bigger entity? If they had even more power? Like I don't think that equates even better. You know, even service care. I don't think that equates. That's all.
The structure of the government has to get bigger because the structure of society and our culture is getting more complex and bigger. They have to do that. And they need to. I just look at it when you talk about stuff like this. I look at it like food processing. Like there's new innovations, like you said, you know, and at the same time they have to regulate it because if you don't regulate it, like they never refrigerated meat. Till FDA's like, "Whoa, guys, all these flies on this, hamburger ain't good, you know." And like, we had to regulate it. And it's the same way with healthcare.
Teddy Roosevelt, that's been going on since Roosevelt. I mean, go figure. Roosevelt is considered a figure that is a champion among
busting up big businesses,
more conservative leaning, but at the same time, the fact that he took government and ironically made it bigger and gave it more power was what actually helped us regulate our lives better. But actually made us more free too at the same time. I mean, that sounds nuts, but having sometimes more rules means you know what you can and cannot do, which allows you more room to breathe, you know?
It actually makes, if you have a box, it's like art. I remember this like saying in art, like, you know, it's easier to create inside of the box, something inside of it, and then just having a whole world, or just like a music. Like, you know, they make chord structures because, you know, you can play anything, but like you have a scale, and certain scales have certain feelings, and you know, I don't know if that relates or anything, but yeah, the structure.
No, that makes sense.
The structure gives you freedom to create, even though the whole,
No, I totally get it. It's like when someone hands you a blank sheet of paper and they say, draw something. The first thing you're going to go is, oh, God, do I draw something good? Do I draw something funny? Do I draw something I actually know how to draw? What the heck am I going to do? But if someone hands you a blank sheet of paper and say, draw a house, you go, okay, I kind of have some experience and I have a set of parameters. I can do this, you know.
Yeah. Totally.
I'm okay with small parameters, but I'm not okay with, you know, if they say, hey, draw a house and it's already dotted line for you. If they give you a blank piece of paper, let's say like small, like hey, draw a house. But with a blanket government full control over it, could be, hey, draw a house, and the lines are already dotted for you. It's just so much control. You have no creative freedom of how the house is to be drawn because they're stuck. Like we just keep making, like you're saying, like you keep referencing the box. Keep defining the boxes, just get smaller and smaller and smaller to where you're just not going to have any freedom in your healthcare choices. Because I get what you're saying. We want healthcare for everybody. And you want people to be taken care of. I get that. But it's an entity that is
You're not a monster.
Yeah.
I understand you're not a monster.
I'm not trying to sound I'm so sorry. I'm not trying to sound like a dick, but these are my feelings.
No, it's fine. I've heard it my whole life. Don't worry about
these are just my feelings on it.
That's classic.
With how the government handles things now, we keep even now, you guys are rattling on the government how it needs to be bigger and bigger. Like it just seems like historically, the more and more government gets bigger, the more control they have, the worse things usually get. And like right now, we're talking about how like the government needs to step in, take control. Like the government needs this. We shouldn't be as dependent on the government as we are now. And I think that would free us up more if we were just not as dependent.
I agree with your point. I agree with that. I agree with the government as it is now is screwed up, but I don't think it's the structure of the government. I think it's the structure of how we're running our government, and I think that is all about how much money and how much outside non-governmental influence we've allowed into our government. The structure of the government as, three branches,
Oh no,
checks and
I
balances,
agree with
beholden
that.
to,
I agree with all
you
that
know what I
points.
mean?
But
Like,
but
so I don't, that's why I don't have any problem saying bigger government. As if we can actually regulate what we
If we
haven't
can
since.
if we can
Yeah,
control our government, basically,
yeah,
I'm guessing that's how it's going. Yeah, if we can
yeah.
control the government and have them do what's fair and what's right and not manipulate. I mean, they don't manipulate. I don't know about
They are,
that,
are
but
are manipulated by outside money,
yes,
which is a big
exactly.
problem
they're
right
A
now.
huge
manipulated
problem.
by
Yeah.
outside money, and they have their tactics.
Which
They have their tactics, which are proven winning tactics.
Yeah,
If you don't say you are, if you're pro-life, you're in pretty much. They know it. They redraw the district lines and they hit the lobby. The lobbyist Roger Stone. He was the one. I know we're probably getting off topic, but like he's
just a
the
little
one.
bit.
I mean, but he's the one like that was pretty much started the whole lobbying thing
yeah,
right after Reagan, and
yeah,
and
yeah.
he
I
got
agree.
a lot of
And then we
con-
had
a lot
And
of
then we
rules
had
made.
Dodd Franklin under I think it was Bush Jr. that had the repeal Dodd Franklin, and then we had Citizens United, and we had that repeal under I think it was Bush Jr. So like I don't think it's a problem structurally with our government. I think it's the fact that we have allowed too much othering into our government. We've allowed too much of the private sector into our government. We need a bigger government expansion. We need to shrink the private sector.
We need a
I disagree with that. I'm going to interrupt because I disagree
That's
with that.
okay.
With shrinking the private sector right now, the private sector is saving us in this crisis right now. Like
Because they've hoarded all of the resources before this. That's
And
why
they
we're in
that's
this
not
situation in the first place.
and they get a
Personally,
lot of money from the government,
yeah,
hundreds of billions of dollars from the
because
government.
they
So they're not
lobbied.
really because
well,
they're covering Medicare.
let's
Medicaid.
like well, okay. Well, I'm gonna break those points apart. So as far as
Okay,
the government rescuing businesses, I don't believe in that. I think you're not too big
me
to fall.
either.
You're not too big to fall. If you cannot look forward ahead to something where I know everything's not predictable, but if you're a big business and you can't sustain yourself over a course of so long on your own without having any outside help, then you're going to fail as a business. And I don't think the government should, like all the banks, they should all fail.
Yeah,
Like,
agreed.
those should all fail. That point
Yeah.
ahead. So, but then I forget
I
the
think
other
they
point
should
because I
be-
got distracted by that.
That's okay. It's okay. Take your time. We got time.
Yeah, we have a little bit of time, yeah. But overall, like with the private sector, there's also more innovation. Like if the government controls everything, then I don't think there's going to be any more innovation. Like I'm just
Well,
going to
that's
use
a thought, though.
let me use it.
I'm
I'm gonna use this as an example. So like think about all those tests that we had for COVID-19. Produced by the CDC, how they had so much regulation through, got to go through the FDA, all that regulation they had, it took 48 hours to get a result back, something like that.
Yeah.
Right. As soon as they lifted those regulations, the private sector got to work on those tests. It got down to, after a course of a week, down to 24 hours, and then after that, it got down like a couple of days later, got down to 5 minutes, and now it's down to 2 minutes. They have 2-minute COVID tests that they're producing right now, and that was because of the private sector. So that's what I'm
But,
saying. We shouldn't just fully dismantle something as innovative as that.
I will say my thoughts on that are this. My thought on that is the companies who are willing to innovate are willing to innovate because they will want that government money. It's no different than when
That's what
Boeing makes it's no different than
Right,
when they want a military contract. So if we want companies to innovate, we want them to innovate because they want that government money, and we want the government to be like, you better do good and you better be priced right or you're not getting that contract.
Yeah.
I don't
So
think that'd be a problem at
That's
all.
what I was thinking. I was thinking
that's
the
fine.
source of inspiration for innovation is still there because the source
Yeah.
of innovation is money. We're still in
Yeah.
a capitalistic structure. It's just now we're just controlling these price gougers, these lobbyists that running in here, buying out senators, giving them 25, like a good portion of
Oh,
money
God.
for.
You guys don't even want to know like half of the governmental. Oh my God, like
Yeah.
I could even go on about government waste. so much right now.
Oh yeah, we'll bring you back on for another topic for sure because this is a great conversation. I'm loving this.
Some of the sorry, I was thinking about some of the things that my husband has brought home from work and some of the things he's talked about. Like he is personally in charge of ordering supplies.
Oh, good.
So yeah, let's just say if let's say there's a kit and it is full of like medical supplies you'd use to do surgery or something like that. If there's medication that comes with that kit that is expired, the entire kit gets thrown away into the dumpster.
Oh, I completely agree. The government spends way too much. I completely agree with that.
Yeah. So, long story short, I have a closet full of scary horror stuff. But anyway, I have a haunted murder house closet full of medical supplies. But anyway, don't even get me started on government waste. I feel like if we made companies be more competitive for innovation and pricing, that would be a major problem. That would be eliminated.
But what's the thing though? To get that competition for innovation, it's usually they want to compete against each other. If you just have the government controlling it all, there's not going to be any competition because the government's just going to say no, yes, no.
It would still be a private company. I think it would just get paid. I mean, in all reality, they kind of do get paid through, Medicare. It just trickles down, and it would be really no different except we would take more control over just get the lobbyists out of there and have vote for your representatives.
No, like that is our biggest problem, the deregulation.
And voting for your representatives, because I don't think we get enough down on the ground level. Let's just go for the top two, and they're already picking sides.
We need to do like a whole episode on the structure of Americans voting and how stupid it is. But I digress.
That could be another topic.
That's another episode. I always do that. I always go on to some other topic where it's a total different topic.
Well, it's kind of impossible to avoid because all of our systems are so interconnected. If this is screwed up, this is definitely going to be screwed up. Then
this is going to be screwed up, and that affects this over there.
Man, you guys are just talking
stupid tree all the way down.
Man, you guys are just talking about how messed up government is, and you want to give the government more control.
But we're doing great.
It's a messed up government, but it's our messed up government.
I agree. Yeah, it is our messed up government. Yeah, I agree with that. Yeah,
I do think our government is great because I think it's the best, but it has the potential to be better.
Yes.
Oh, I agree. I'm always up for improvement. That's why we're having this conversation.
I would want to go.
Yeah, exactly.
Yeah, you're here. We just kind of talked over you for a second on accident.
On accident, wink, wink. He's trying to make you fight for it. He's trying to make you fight for your job. He's really considering. He's like, well.
What's up, guys? I'm back. I had a headphone outage.
Oh, we heard you the whole time. Your phone.
Oh yeah, totally. Yeah, like that totally wasn't like planned to be like, oh, well, he's gone. This is no different. No, I'm kidding.
Totally. Nice.
All right, so I'm gonna try to bring us back in because there's one more talking point I want to get to before we wrap this up. It is a big topic point. It's more electional, but it's just something that kind of encompasses all of this, and that is healthcare. Should healthcare be considered a right?
Absolutely.
Yes.
Absolutely, 100%.
Yep. Everybody should have access to healthcare, no matter how rich or how poor you are.
Yep.
Okay. So
man, woman, child, non-binary genders.
Viva la revolution and.
And to be on another topic, I believe animals too.
Okay, that's a whole. Ralph, this is a blackfish issue again. We're not going to get into the animals again. We don't care about Snickers and SeaWorld. We're not talking about that right now.
Dental care for tigers is a real issue on his mind right now.
Okay, so I'm going to be the contrarian on this one. I say no, and this is the reason why. Because if the government makes it a right, then they can take it away. They can try to take it away. That's just my whole premise. Do I think healthcare should be provided for everyone? Yes, that's what we have the insurance companies for right now, and that's why I think a free market system where potentially there could be hundreds of different insurance companies that you could choose and pick from and have this competition would be better. That's why I don't think the government should be like. In their constitution, yes, healthcare is a right. Well, if the government sucks at providing you healthcare, then everyone's going to have shitty healthcare, and it doesn't matter if it's a right; it's still shit. You know what I mean?
Yeah.
That's why I don't agree with that premise of just saying healthcare should be just a right. Well, put it into context. What if the government sucks at providing you healthcare?
How about the Hippocratic Oath, though? In the whole idea of being a doctor or healthcare provider is like inscribed in their oath. Like they have to take care of us.
I think
And
if we had, it's kind of like how it's kind of like a Supreme Court ruling in some ways because we are given a very basic structure to our government, and I feel as though if we are given very basic instructions, then we at least have the ability to interpret them. Like the United States, we are really,
It's the world's
really,
most
really
powerful.
good at kind of trying to find a way to add to the Constitution, but we are really not that great at taking away from it. I mean, it takes a lot. So I feel as though if we had basic instructions that said healthcare is a right, no matter what, and people absolutely had to work with that, we would eventually have to find the best way to work with that as opposed to completely blowing it off and ignoring it.
Well, the only problem with
You
that
know.
is if the government's got to find a way for it, they got to find a way to pay for it. And the way the government runs money now, that would just I could just see that ending, and
And that's
for
why
poor
that's why
like
you should do Medicare for all
no,
because it's cheaper.
you say it's cheap,
Sorry.
you think it's cheaper,
It
but
is.
look at
It is.
look at your taxes. Like your taxes
I
are
know.
going to go up drastically. No matter what kind of care you get, you're going to be paying a lot more in your taxes. Like that's
But
or
that's
that's why
depending on
undeniable.
how they do it. Also,
That's
it might be
that's
like
why
a
it's
yearly
the
thing.
yeah,
I mean,
but that's why I remember the boot economics. Sure, we are nickel and diming ourselves to death with a really shitty system. Why don't we take a nice deep breath, buy the leather boots, kind of hold our nose for a few years, and then realize, oh, I can't feel the ground beneath my feet because I'm walking on leather and not cardboard.
yeah.
I just disagree with that whole like let's just
No,
let's
I
just let's
understand.
just decrease the like because here's my thought on it. You decrease the quality for everybody just so everyone has, like say right now people have different healthcare levels between 1 and 10. Like some people have twos, threes. Like everybody, we just drop everybody to, a 5. What about those people that that worked really hard, like those union workers that worked for that 7 or 8? Why should they like?
I don't imagine quality would change though. That's the thing.
If
I
anything, I think
feel
it would get better because
I disagree. Like you could look at many examples. I don't have them off the
I
top of my
feel
head,
like
different references, but think of Venezuela, like their healthcare system right now, how much it crashed when they switched over. I'm just
I think Venezuela had a lot of
Is it-
other problems.
they did have a lot of
No,
other problems. Yeah, that's true.
that's
You know
kind
what?
no, not gonna lie. I understand your point. Venezuela's a bit of a red herring though, because it's got a lot of socioeconomic, historical problems of like getting invaded. So that's not exactly necessarily a great. We could say, oh, look at Russia. It's like, yeah, but Russia also had XYZ dictatorships.
That's
You
true.
know,
It's
and
all
literally
it's all
the Soviet
anecdotal,
bloc.
really. But yeah,
So I feel as though if we really did have a system where it said, congratulations, go pick a doctor, it's paid for by your taxes, it would open more healthcare options. Like we would have to have more healthcare. We would have to have more doctors, more hospitals. It would just expand our job opportunities, which would make our economy boom.
what about all those jobs lost in the healthcare or the insurance industry?
Data entry is not going anywhere. You need
Yeah.
to do data entry in order for
Right, but-
patients to register.
But there's also other people in the insurance companies, I just don't see where are those jobs going to go.
As
Like, I
the
just don't-
structure changes, it will shift, and there will
Mhm.
be there's
Well,
going to
it's-
be a need of them and more people.
This is a terrible tangent, but it's kind of like how people are facing the energy industry right now. A lot of people are afraid that when coal goes away, coal jobs will go away. But in truth, do you know the number of coal mining jobs there are in the United States right now? 50,000. That is less than the number of people who work at Arby's in the United States.
Yeah, but
Like,
on the energy
what I mean?
topic,
Those jobs will shift. Those jobs will shift. It will be a lot less of a headache. This isn't like an instantaneous thing. This is we have to retool our whole system. We have to retrain people. We have to add new things. Like the opportunity to create new jobs, create new systems, create new hospitals, create new technologies. I mean, bring manufacturing back to the United States. Like I don't know. I just see this as an absolute possible win.
Yeah, it's a change. It
but
it might be a win, it might be a lose, but it'll be a gradual change. And if it doesn't work, we'll change the structure, adapt or die. That's what I think. And I mean,
Yeah.
that's how I feel. And you just have to change it. You just cannot live in the repeat of what every 4 years another pendulum swing, another 4 years another pendulum.
I agree with
Yeah.
I agree.
We're gonna get nowhere. We're just gonna keep
Yeah.
on swinging.
I agree with the moving
slowly.
pendulum analogy, like how like we're always going back and forth, back and forth. But I just think leaning towards more of a system that is different from everybody else, like a free system, a truly free system, where the consumer is in full control. I think that would just be better overall than a giant umbrella of this big bureaucracy that is our government, and giving it more power. Because what if that wrong person gets in office? You know what I mean? In the future.
Yeah.
Sorry,
Yeah,
sorry, I shouldn't have laughed that hard.
You can laugh if you can just worse. Okay, worse
You
than
think
Trump.
it's gonna get worse?
It could. You never know.
Yeah,
Sorry.
it could get.
I don't
know.
Sorry.
We could talk about
That
we could.
that was very ugly, cruel laughter on my part. I'm sorry.
You're fine. You don't have to. You don't have to like Trump. I think as a person, he's not the greatest guy, but I think he's done. But he's done. I think he's done a decent job for the person that he is. He's not the best. He's not the best. He's not the best. He's not the best.
Sorry. I'm gonna be really charitable and not turn this into something really horrible, because that's not our point.
No, it's not. Yeah.
Anyway.
He's our first reality TV star president. I mean,
Oh God! Please say he's our last. Please say he's our last reality star president. Like, please don't say he's the first. Please say he's our last.
Yeah.
Steven Seagal. He's
All right.
not a Russian agent.
All right.
Black
So,
Jackson ponytails 2024.
all right. Is there anything you guys want to summarize with healthcare before we wrap this up and move on to our last thing we're going to talk about?
Like,
Yeah, one
just
more
like
thing.
basically, I think we said a lot of it, but like, okay, well, my summary is just I believe in Medicare for all. I believe it is the solution to an aging, imperfect system in which not everyone is taken care of, not everybody can afford it, and not everyone, like, it's not appropriate for our population. You cannot keep this cobbled together system for 360 million plus people and expect that it's going to work, and it's going to work for everybody, and everyone's going to be cared for, period. We're spending so much money, it's proven it doesn't work. It just, especially with Corona 19, it doesn't work. It just, period.
All right, Yin, any final words before we move on to our last topic?
No.
No.
Smart man.
Man, a few words. No. All right.
One word that doesn't count.
Fair enough.
Exactly.
All right. So, all right. If he's had nothing to say, then I understand where you're coming from, because I feel similar in the way that I do believe that we should take care of our own people. I just don't think the government, us relying on a government system that is innately flawed, that we're already, we've been rambling on about how horrible it is, that if we make it bigger, we think it's going to somehow make it better. I think more of a free market approach would solve more of our issues now, because yes, our current system is not perfect, but I think if we just give the government more power and we socialize it or put it into a single payer healthcare system, we'll be taking a step back. So that's just my thoughts on it. Now, I think we should move on. Like,
Yep.
Let's summarize, encompass all this, summarize it. People, see how hard that is? That's not that hard.
Mm-hmm.
We all disagreed, obviously. We all have different views on it. Get the conversation going. Don't be afraid to say what you feel. Like, we're all adults here. You should be able to just talk to your fellow human. Like, we may disagree, but I still respect Shannon. She's still a human being. I'm not going to hate her now because we think differently. I think that's ridiculous.
Don't you know? I think you should go die in a Soviet gulag. No, I'm kidding.
You damn Bernie bro!
No.
I'm gonna get doxxed by the Bernie Bros now. Thanks.
Oh God, no. There's no time for that. Everybody's.
I know.
No, they've got lots of time on their hands. They're all stuck in their houses like the rest of us. So.
Exactly. That was a joke. By the way. That was a joke, by the way. All right.
Even the 2% are stuck in
It's like, that was a real joke. Don't. That was a good one. I like that.
All right. So now, kind of just to talk about something serious, like kind of uniting us all back together. I kind of wanted to bring up the story. Me and Yen talked about this. The story of Army Captain Douglas Lynn Hickok. He was the first U.S. service member to die due to COVID-19. So I feel that it's only right if we talked a little bit about him, because this is a serious thing. It's not just affecting, upper class, middle class. It's affecting everybody. And just when I saw this, this happened, I don't remember the date. I'll have to look up real quick. It happened last week sometime. And it's something serious, so I just want to read a little bit from this article. A New Jersey National Guardsman died over the weekend after it was last weekend, testing positive for the coronavirus. The Pentagon announced the first U.S. service member died of COVID-19. His name was Army Captain Douglas Lynn Hickok. He was a physician assistant. He died in Pennsylvania after been hospitalized since March 21st. Yeah, I think that's horrible. Like these people are on the front line, so if, like, even if like all of our rambling or our jokes aside, this is still a very serious thing, and we want to encourage people to keep the conversations going. We want people to still talk about these issues, but there's a lot going on right now, and it sucks.
Remember why we're having these conversations.
Yes.
Keep perspective on it.
Yes.
You know? We just had our first death in our county of COVID-19, and it's been a real concern and a fear of mine because my husband's job is healthcare. He has been going into work still in the mornings. He checks people for fevers at the door. You know, he tries to get some paperwork done. Up until about 2 or 3 weeks ago, he was still going into the clinic and seeing soldiers on post who have the possibility of exposure, because we have in fact received word that there were some people on base that tested positive.
Yeah, and that's a
real. That is, you know, and like we've got a baby at home, so yeah, it's really real too.
Yeah, I got 2 brand new newborns, and
yeah,
I'm just
exactly.
absolutely freaking out. And yeah, as the precautions they took in the, you know, the hospital, and just how everybody's coming together, like, you know, like we were talking about earlier, just like everybody's like actually, it's you know, brings people together, you know. Mm-hmm. It does, but at the same time, you're taking precautions, and
yeah,
you know,
it's like we're never more physically apart, but we're never more mentally together from everybody being in the same thing.
Totally.
All right, so everybody, make sure, you know, if you get a chance, thank your first responders, your first line workers, like anybody in the healthcare industry right now. Thank them. Like they are doing some serious, like they're in the front lines. They're the military of this right now. They're on the front lines. They're taking care of people. Like, thank your healthcare workers. Go on.
Yeah, the whole infrastructure too, man. Like everybody is taking one for the team. It just going out.
Yeah, if you don't have to leave your house, thank the people who absolutely have to make sure you can survive not going out.
Yeah, because it's just people serving food, people at Kroger's. I mean, Kroger's, like, wow, dude, like that is. I seen them install pretty much shields for their workers, and I was like, that is awesome. Yeah. That is smart. But I'm also always looking at cross contamination, and I was like, like. Yeah. But that's just me because I'm a germaphobe. So,
no, I think that's very. I think everybody who has OCD now, you know, or has some sort of like. No, I mean,
no, you're right.
I respect mental illness and all that stuff. But all the people are like, oh, you're crazy by, and they're kind of like, well, don't come to me looking for your soap.
Yeah. Like exactly, like yeah. And the doomsday preppers are all sitting back like, told you so. I've got a shed full of toilet paper. You all laughed at me.
Which toilet paper has nothing to do with actually the symptoms, but whatever. We digress.
God, nobody wants to eat that much peanut butter, though. Oh my God.
Then you would need the toilet paper. Let's just put it that way.
God.
All right, let's digress.
You need a paint scraper.
Oh, okay, we're stopping. Shannon, it was great for having you. We thank you so much for being our first guest, and we hope to have you again for future topics. I mean, that'd be awesome.
I have a horrifically terrible, tough act to follow, and the next person chokes. No.
Who knows? It'll be Yen, and you'll just have this job. So.
I'm coming to get you. Not really. All right, thanks for having me.
Down.
All right. Well, that was fun, wasn't it, bud?
Heck yeah, not too shabby.
That's fun. All right, so thank everybody for tuning in. You want to talk about our big announcement we got coming up for future on this channel?
Oh yeah, we're going to be doing short clips throughout the week between episodes, just a whole bunch of trending topics, whatever topic, funny videos.
Yeah, just
or whatever.
Yeah, just something to keep you guys entertained between the week. We're going to try to pump out 2 episodes a week. I think we talk about Wednesdays and Fridays. We'll have like a mini like 10 to 20 minute episode of just us talking about a little topic and a couple like quick hits of just little things that are relevant. So we don't have to wait. You guys don't have to wait the full week to hear from us.
Yeah, and it'll probably be funny as heck.
Who knows?
Not to come.
It'll evolve as we experiment with it. It could turn into little clips of us just being goofballs and doing little short skits. We don't know. It could be anything. That's the great thing about it. It's just more content for you guys because we are coming in. We're hitting this strong, and we can't thank you guys enough that are listening and have stayed through the full video. You
We're
guys
coming
are
in
awesome.
hard.
Phrasing. All right. So you got anything? You got anything to close out, Yen, before I do this outro?
Nope. Peace and chicken grease.
There we go. I love it. I love it. All right, guys. So just remember, hit that sub button. It's free. It helps us out a lot. We want to get this channel out there. We want to get more views in. After you subscribe, hit that like button. That helps. You have no idea how much that helps us. Also, comment.
Yeah, totally.
Talk with us. Talk with us. Tell us about what you think, your ideas. We want to hear from you guys, and possibly we want you on the show. You never know. And also hit that notification bell. Make sure you select all, so that way you can stay up to date whenever we decide to post our new funny clips or the next episode. All right, guys. We appreciate you guys so much. And all right, peace out. Thank you so much. Bye.